This video is about boils. What are boils and how do they form? Yeah? And what are the predisposing factors? What is the treatment and the causative? The preventive therapy. Yeah? Now, boils form as a result of skin breakages. The skin lacks some integrity, and the damage of the breakage on the skin allows bacteria to go through and then go all the way to the tissues, the deep tissues, and then cause the inflammation, the infection, and also the formation of the pus, the production of the pus. Now, so first things first is that you have to have entry of these bacteria into your skin. Particularly the bacteria, the most common causative agent for the boils is called the Staphylococcus aureus. Now, for you to have the boil, there's entry of that bacteria, and then it goes all the way to the deep tissues, and then they cause the inflammation, they cause the infection, and also they cause the formation of the pus. Okay? And there's a difference between the boils and the warts. The boils are caused by the bacteria, while the warts are caused by the viruses, viral. Okay, so it is insane for you to try treating or to attempt treating the warts using the antibiotics. They will not go anywhere, because antibiotic therapy mostly focuses on the bacterial infections, yeah, and not the viral infections. Good. Now, also, you can actually be having some very good skin that has perfect integrity, but you still end up with boils. Why? Because your immunity is low. So one of the risk factors is low immunity for the boils, yeah? Good, so what are the other risk factors for somebody who has boils or who has had boils? Number one is contact. When you interact so closely with people with boils, you're also likely to have the boils, yeah? Yes. Number two is having high sugar levels in the system. I don't want to call it diabetes, because even people with pre-diabetes, they put themselves at risk of the boils. Because when you have pre-diabetes or diabetes, that simply means that you have a lot of sugars, not only in your blood, but also in your cells. And these sugars, they lower your immunity or body's ability to fight the infections. And when your immunity will be lowered, any infection, particularly even those ones that are caused by bacteria and viral infections, are likely to overwhelm you. And in this case, people with diabetes mellitus, you always find them having any form of infection that is going around, the flus, infections, wounds, and all that, because the immunity has been lowered by the sugars. So having a DM or diabetes mellitus puts you at risk of the boils. Yeah? Good. Number three, people with HIV and people with cancers. Same case, same category. Poor immunity and low immunity. Also, the treatment for the cancers, the chemotherapeutic agents, they lower the immunity of the body and the body's ability to fight any form of infections, okay? Also, the consumption of simple sugars or the carbohydrates, another cause. Low immunity, and therefore boils and any other infections are likely to overwhelm you. Something else, when you have the boils, is it really necessary to pop that boil? Is it necessary? Because I've seen people saying when they have the boil and then they take a full course on the antibiotics, yeah, the boils go away. But after some time they recur, but they don't recur on the same point. They shift to a different point. Let's say you had one on the neck, and then the next time you have them at the gluteus or on your thighs or on your armpits, yeah. When you pop that boil, yeah, you pop it because it is necessary, because what are these, the purines that are found in the pus and also the folates will act as food or substrate for the same causative agent, the Staphylococcus aureus. So it is necessary, it is imperative, when you are taking the course of antibiotic, that you first of all pop that boil. Because you can take the antibiotics, but you're still on this other end feeding the same bacteria using the purines and the folates that are found in the same pus cells. Therefore, when you pop it out, you get rid of the substrate or the food for these bacteria, and then you can take the full course of the antibiotic. That way, it will not recur. But when you take the antibiotic without popping it out, it will recur. in another part of the body. So therefore, take care of yourself. Also, heal your gastrointestinal system. Why do I insist on the gut and the gut health? Because if your gut is messed up, we see it on your skin. Yeah, and when you're not, your gut has issues, it is difficult for you to even absorb nutrients in their optimum and adequate amount. Also, when you have the skin lesions, when you have the eczema, when you have the acne, the skin will have some breakages, and therefore these bacteria will gain entry into the skin, causing the infection. Are you seeing how these two are related? So you have to heal your gut. Also, if you have high levels of estrogen, of course you'll have that cystic acne. By high levels of estrogen, I mean, as a woman, either you are fat or you have those hormonal imbalance issues that will predispose you to the cystic acne, and therefore the skin breakages, yeah, and therefore the bacteria will gain entry. Okay, also improve your immunity, and the simplest way to improve your immunity is by fasting, by enjoying the sun every day, enjoying the sun because of vitamin D activation. Also focus on the keto diets so that you can synthesize cholesterol and also synthesize the same vitamin D. Okay, take water with some salt. It also helps in healing the gut. Sleep for a minimum of 6 hours every day. 6 to 8 hours every day is enough for you. Yeah, also exercises. These factors will contribute to improvement of your immunity. And when you improve the immunity, even when you have access or you get into contact with people with boils, or you have exposure of the Staphylococcus aureus, it will be very difficult for you, for your body and your immunity to fight all these infections, and therefore you're going to survive. Okay? I hope this helps.